Okay, before we can literally start marketing our company, we've shared with you guys some of the great ideas. We've been giving you guys so much information through our videos to be able to help you guys literally learn marketing techniques and training to be able to know how to go out there and how to make yourself stand out from the competition. But sometimes we have to go back a little bit and really first make sure we know the products and services, not just adding other companies or other products or other services for our organization, but to literally know the genesis of things, the beginning of everything. Before we can literally sell or market our product, our home health agency, our home care, our company, we need to make sure that everyone knows it first. We need to be able to make sure that everybody knows what it's about, what services we provide, what are the basic services that we can provide, that we can do. What are the basic problems that we can pinpoint, that we can solve, that we can help people with? Because a business is literally a problem solver. We find a problem. If the problem is big enough, we're going to be able to get a lot of business. If we can't find the problem, we can make sure that we can identify more problems. So what is home health? What is hospice? What is home care? What is private duty? So for Medicare, medical home health agencies pretty much, for you to be able to be approved, to be able to receive home health services, there are several things. Number one, your doctor must decide that you need medical care at home and make a plan for your care at home. You must need what we call intermittent skilled nursing care, physical therapy, speech language therapy, or to continue occupational therapy. The home health agency caring for you must be approved by the Medicare program, henceforth Medicare certified. The patient must be homebound or normally unable to leave home without help. If they can go to church every now and then, that's perfectly fine. So that, just because they're able to go to church, it doesn't mean they're homebound or they're not homebound. So what you want to do is you want to be able to, first of all, bring in the right patients. You want to be able to make sure that any client that you admit on your medical home health agency, that they actually are qualified for this. We actually have a step-by-step decision tree that helps referral sources make a decision if a patient needs home health services. So this is something we can share with you. If you want to be able to have a sample of it, we can definitely do that for you. We can also create it for you with your custom logo in it if you prefer to have it there. So you want to be able to know what services are there. What other services can you provide patients under your Medicare agency? Where there's additional things that, of course, is going to be out of the pocket expense, but is what's going to make you different. But these four little items right here that I'm sharing with you guys must be known, and you must definitely know it so that you can provide the right care, so you can provide the right information. If you don't have the right information, you can accidentally make a mistake. So what's hospice? What's home care? What's private duty? So like you have your home care and private duty. Typically it's the same exact thing. You're providing, so home care is providing what? Non-medical services to a patient at their home. Okay? You're providing your caregiver, your homemaker, somebody to be able to be there with you 24 hours to give some basic assistance with bathing. You also then have your private duty, right? So you can also have private duty nursing, skilled nursing, but because the patient is unable to pay for it or is not covered by the insurance or is not covered by Medicare, but they do need some typical skilled nursing, and you can afford it, then you can typically hire a private duty nurse to be able to provide these services for you. You also want to be able to know the laws in regards to home health agencies, in regards to AKBL or anti-kickback laws or the Starks law. You can definitely go to medicare.gov and be able to do a search on this and to be able to gain the information that you need. But you want to be able to make sure that you fully are aware of these laws so that you are not breaking any of the laws at all. You don't want to be part of these organizations that are committing fraud. You don't want to be part of the organization that doesn't know that they are committing fraud and gets in trouble because of it. You don't want to go through the pain that people has to go through this because they hired the wrong person, because they brought in the wrong person who created problems within the organizations. Bring in the right people, know the law, and follow it thoroughly. You want to be able to talk about planning the nine laws of the Home Health Success Academy. If you literally plan these 9 laws, you can literally have and create a successful plan. You must be able to have desire, the knowledge, imagination, the decision, persistence, enthusiastic, organized planning, creating a mastermind group, and handling your subconscious. So your desire, you must create a desire to be able to what? Have success. You want to be able to make sure that you know what your goals are. Your desires, your goals is the same thing. The next thing is you must be able to create knowledge and receive knowledge. There are people that we say are natural marketers or natural people. They're not. They learned that as they grew up. When we're born what? A baby. So we don't have the skills. We learn it in their field. We learn it as we grow up. So you must be able to obtain the knowledge, and if not be able to obtain the knowledge yourself, seek the knowledge. The next thing is you must have that imagination of creating the imagination of success, that imagination where you can actually start thinking. You can actually imagine how things are going to occur, the predictability of things. You must be able to take the knowledge that you learn, but create an imagination on how to be able to improve it better. You must have that decision, to make that now decision, to make that commitment, to make that decision now and start choosing now for success. Because if you wait till later, if you procrastinate, if you decide to later, meaning that you just literally decide to just go ahead and make the decision that you can do this later on, that you'll worry about marketing later on. You need to be able to make the decision now. If you decide later, you're not going to succeed and you will be closing your doors. You must have persistence. And I shared this with you guys, the persistence to be able to go out there, to be able to have the follow-up techniques, to be able to understand that to be able to succeed, you must be willing to follow up all the way through. You must bring in that number 6, enthusiastic support. You must bring in the right type of people to work in your organization. You must be able to also work with your family to be able to show them what your goals are, what your desires, what success you want to be able to have for yourself and for them. You want to have the right people that surrounds you. Your future, there's a study that says your future is determined by the 5 people that you surround yourself with. You surround yourself with successful people, you will create success. You will surround yourself with losers, you'll become a loser yourself. If you surround yourself with like-minded individuals at work who wants a successful company, who wants to be able to have an organization that is envied by other agencies, those are the type of people you want. With having those type of support, you can create planning. You can organize it correctly. You can use the knowledge of what you're doing, use your imagination to create that organized planning capability. We talked about the support. The next one is your mastermind group. I literally worked and have worked with so many people. And I always surround myself with people that can improve myself, that can help me be a better person. You must surround yourself with great people. You must go outside your agency and find other people. And I'm glad that I'm able to sit here with you and talk to you and create a mastermind group. You already have one in your corner. That's me. Someone who wants success for you. Lastly, you want to be able to have and handle your subconscious. We forget that our subconscious sometimes is the reason why we stop doing things. We forget that our subconscious is the reason why we're not succeeding. Because deep down in ourselves, we don't want to change. Deep down in ourselves, sometimes we also commit the biggest sin and prevent our own selves to succeed. So I want you guys to start thinking about planning your 9. Planning literally the 9 laws. And if you can create these laws within your organization, you're going to be able to build an amazing organization and put that together. Okay, let's talk about niche markets, or however you want to pronounce this. I always mess this up actually. What areas can you hit in this industry that a lot of agencies are not looking into? The first one is the pediatric care. If you try to look for pediatric home health agencies in your area, there is not a lot of those type of agencies. We try to tend to work with a lot of seniors, and that is it. So one of the biggest niche markets to be able to enter into is the pediatric home health services. It's very good for both medical as well as non-medical and private duty. The next one is non-medical. So for a lot of you guys out there who are home health agencies, who are medical home health agencies, typically they do not like to have non-medical when this is a great source of income. You have to understand, you already have the resources. You might as well start using it and providing it rather than giving it to somebody else. So for you non-medical people, be happy. Be happy the fact that you have home health agencies that could be potential referral sources. So you want to be able to attack and use non-medical. Some of the top franchise organizations nowadays are in the senior home care field. There are franchise organizations right now that are bringing in hundreds of people to join their organization to start a company to provide non-medical private duty. And you have all these approved home health agencies who don't even want to offer these services. There's so much money to be made in the private sector, in the non-Medicare billing, non-insurance billing world. Third one is your Advantage plans and insurances. Are you accepting Advantage plans? Are you accepting managed care plans? A lot of medical home health agencies are just relying on Medicare, are just relying on basic insurances to accept. So you need to start looking into other payer sources. Are you accepting Medicaid? Yes, the income, the profit is lesser in Medicaid, but if you work hard enough and bring in a lot of clients, there's a potential income for you to be able to be made that makes you stand out. Are you grouping with other home health agencies? You have a bunch of ACOs that are building out right now. Have you tried to link up with other home health agencies and created your own PACs, your own post-acute care organizations, where you can set up a group, a team that can market yourselves together and be unified to market to hospitals and nursing homes, to be able to have that one idea outlook and show other companies that you're willing to join together to provide great care. So what are the other niche markets you think you can actually enter? What other subjects and offers can you actually provide with your company that makes you stand out? How do you literally differentiate yourself? Can you differentiate yourself? Now, I also put here culture-based marketing. Very important. How do you differentiate yourself? Well, cultural-based marketing. Do you have Spanish-speaking nurses? But the worst thing about this is, do you have brochures and marketing materials that are just meant for Spanish speakers? What is the number one and number two second spoken language other than English in your area? If you're in Chicago, then you have Polish. If you're in California, you have Spanish. So what in your area is the first and the second one? And even the third and fourth, and use that to market it. Bring in the people that can actually work with those type of clients, those type of patients. Specialty programs. Don't just say you have it. Everyone in your team should know about it. You should have specialty programs. How do you make yourself stand out? Other than saying that you offer skilled nursing and you offer quality nurses and you have a 24-hour call center, right? You need to add programs and services that makes you stand out among the rest of the agencies. You must have a dementia program. Now you can bring in and have one of your team members become an Ashby Memory Method certified provider. So what's the Ashby Memory Method? Well, it's used before to treat patients with brain injuries. And now they kind of figured that dementia and Alzheimer's is another type of brain injury. So by using this type of program of training of the brain can assist clients who have dementia, as long as we're able to actually work with the clients at an early stage. Now, you can offer this for free to say that any patient that has dementia, we actually do the Ashby Memory Method. Or you can also offer this as an additional way to make extra money, where you can charge. You can give your free initial consultation and then charge from there on what you can recommend for the client. And then at the same time, is by you having this, it makes you stand out, which makes you look good in front of the nursing homes, the long-term care companies, the assisted living communities, the senior communities. Emergency respond button. Do you have these? Do you offer these? Do you offer your staff, your clients, a medical alarm system that if they have any problems, that within a push of the button, if they fell, they had an emergency, that they can have and contact 911 immediately? This assures the person that there's somebody in the other line that's going to be there for them if they need help. What's the cost for one of these? Typically, you have one of these for $30 a month. If you offer this to every single one of your patients that you admit to your company, how much is that worth to you? What's $30, but you're able to show to potential referral sources that you care for your clients, that you're willing to add an additional service that other home health agencies are not even offering? That you're willing to invest into your patient's care. You're willing to invest in their safety. You're willing to invest in their comfort of knowing that somebody is there to reach out to them if they fall. Because your nurses are not going to be there 24/7 for a medical home health agency. Your therapists are not going to be there 24/7. So you want to be able to have this as an ability for somebody to feel better. Remember, it's not the basic services that you're offering, it's what you have to make yourself stand out from the rest, to be able to dominate and not compete from the pack. Do you offer telehealth systems, a telehealth program? Do you have a COPD, CHF telehealth program, a diabetes telehealth program, where you can have products at the patient's home, so if they take their weight or they take their vitals, it automatically gets transferred to somebody in your office, so that there's any large amount of discrepancies or differences or abnormalities, you're able to notify the doctor right away to prevent the patient from worsening or having to be able to go to the hospital. Did they gain 5 pounds or lose 5 pounds within the last 24 hours? Are their blood pressure sky high? Are their pulse low? Are their O2 sats below and they need oxygen right there and then? What can you do to make yourself stand out? Telehealth is known to be able to reduce the readmission rates of a lot of patients that came from hospitals. Yet 5%, only 5% of home health agencies in the United States actually offer telehealth. Now, a lot of people will say, look, there's problems with telehealth. They cost too much. It's not meant for all the patients. What if it gets lost? The staff is not trained. Expensive, yes, but this shows your commitment to the success of your patients, to the care of your patients. Yes, it's not for all patients, and that's why you have to be able to train your team to be able to assess the patient correctly if they're going to be able to use telehealth. What if it gets lost? It's part of your business. Henceforth, you have to make sure that you monitor the patient. You have to make sure that you actually see if they're actually a right fit for the services. What if the staff is not trained? That's your job to train your staff. If you have these products and services, it makes you stand out. Wouldn't you want to be able to stand out? Do you want to be the other 95% who doesn't offer telehealth? Or do you want to be that top 5% who does offer telehealth? Point of care testing. Do you have PT-INR machines? Are your nurses able to obtain the PT-INR results? A lot of physicians complain that they get called 5 o'clock, 6 o'clock at night for PT-INR results. When you can actually do it right there and then, point of care testing, and give them the results so you can then get the change of Coumadin orders if need be right away. What other point of care testings do you have that you can bring with the patients, that you can actually show yourself, that you can actually tell the doctors that you offer this, that you offer a Coumadin at-home Coumadin clinic? That the moment that you get the orders from the physician because you gave them the PT-INR results, you can actually get the medications, the Coumadin, the warfarins delivered to the patient the very same day so that they can start on the dose that's been changed if there was any changes. Do you offer high-tech nursing? Yes, all nurses are trained and should be trained to do IV therapy. Should be trained to be able to handle a lot of the IV medications at home. But just because they're trained and just because everybody should expect them, that doesn't mean that you don't give them more training, more education, more continuing education units. Then market it out. Let people know you're a high-tech home health service company. That you guys provide IV at home. That you provide IV antibiotics, IV hydration, IV medications. Make it stand out. Make people know about it, that you guys are trained and well-trained at it. This is for medical and non-medical. Are you offering video chat with patients? If you're offering telehealth, they have an iPad or they have a tablet in their apartment, in their house. Allow it where the patient can actually contact you or someone of your staff members via video, where there's a person-to-person touch, where you can see eye to eye. It gives them the comfort that they're there. But imagine this, now that the patient has one of those, and yes, it's going to cost some extra money, but it makes you stand out. Imagine you have one of these at the patient's home where their family member can now talk directly to the patient and video chat one-on-one when they haven't seen each other. Everybody has smartphones nowadays. There's so many different ways to be able to what? Make yourself stand out. And video chat with family, with friends, with your medical team is very vital. You can even offer this and tell your physicians, doctor, if you want to be able to talk to your patient, even though that they're at home, you can have a one-on-one conversation with them with a video chat. We can show you how to do it and how to set it up with your own computers. I put together a LACE study. Okay, a LACE study, what happens is it's a graph that's used in some hospitals to determine if a patient would have an increased chance of ending back in the hospital and get readmitted because of certain information that they have, such as history, such as vital signs, such as their current sign and symptoms, and their diagnosis. Well, we reached out to some hospitals and said, you know what, we know that you're using the LACE study, but guess what? We also do that when we actually admit a patient. We also do a LACE study to see how they handle at home. So LACE study pretty much a length of stay, acuity of the admissions, comorbidities, emergency department visits. What we do is we tell the hospitals, the potential referral sources, that we are doing our own studies, and when we actually do this quick assessment, it lets us know if a patient needs more help. And this is actually how we determine when we actually make sure we use a telehealth program for a patient. So you want to be able to show them that you're also doing additional things that other agencies are not doing. Other than your typical basic admission program, whether you're doing your assessment for the patients, what else are you doing in addition that the average home health agencies are not doing? Look, you had to do anything. I showed you the LACE study. I told you about the telehealth. I told you about the emergency response button. The whole main purpose of all these things is to be able to reduce the rehospitalization rates. There's a change in our area now. We must be able to learn how to reduce the readmission rates. If we can actually reduce this and show hospitals that we reduce the rehospitalization rates, it makes us stand out. It makes them want to start working with us. That is the biggest goal that you should always have. Now, in addition to reducing the readmission rates, how do we do it? Once again, one of the biggest reasons for admissions is the medication non-compliance. So what we provide is we provide a daily medication reminder where the patient is called daily to remind them every 5 o'clock in the afternoon if they took their medication, if they haven't taken their medication, to actually take it right there and then. So if you have low census, have somebody in the office do it. Have your nurses do it. But there are a program that we're working with a company now where for $5 a month, the patient's going to get called on a daily basis to let them know to take the medications. Non-compliance in medication is one of the top reasons for readmissions. You need to be able to show how you guys stand out from the rest, how you provide other services that the others cannot provide. What can you provide? Do you have other additional thinking or ideas that you can actually provide people? Medication management is so important, and it's a great way to be able to get more patients. So I want you guys to start thinking, what else can you actually offer? What else do you have that's going to be able to make you guys stand out, that makes you different, that makes you guys and makes people want to start referring patients to you, that's going to make people want to start working with your organization? Okay guys, so we're almost done. Okay, so we have a few more slides left. I just want to finish things off a little bit and give you guys great and valuable information. Things that has helped me on how I've created my mindset and how to be able to market my organizations. So let me go ahead and literally just say something to you guys about marketing. Okay, I've shared with you guys a variety of different niche markets to get into, techniques to make yourself stand out and dominate and not just compete, to be able to know the different programs and processes to be able to create a successful company. There's nothing more important than to attach pain to not closing. Your client will benefit, your patients will benefit, your referral sources will benefit from you closing more than you will. If they start using your services, their patients are going to be taken care of, which makes them look good. Your patients are going to be taken care of, staying home longer, enjoying being able to be at home rather than being at the hospital, long-term care facilities. Okay? Now here's the problem though. For referral sources, once they refer a patient to you, once you get that first referral, it's going to end eventually. If you're medical, it's going to end in 60 days. If the patient is viable to be renewed, then you renew them only if they are capable and should be renewed for recertification. So when you close one and get their referral, you need to do everything you can so that you have more of them coming in. So just because you get one referral from a referral source, that doesn't mean that they're going to remain your client forever. So you need to do everything possible so that they remain a client and you continuously get referrals. Okay? That right there is what's important that you need to do. You need to be able to learn ways on how to be able to create success for your company continuously. And that's why I teach the closing. So in this part, as the end portion of this presentation, the closing part of this presentation, I want to be able to share with you and teach you guys some closing strategies, some closing techniques, some closing scripts, so that you can understand and know that you must be a great closer to be able to keep your company viable, for you to be able to keep your job if you are working for a home health agency. You find the problem, you solve the problem, and eventually a new problem begins. So let's attach pain to not closing. If you cannot close a referral source, if you cannot close them to have the appointment, if you can't then do a presentation and not close them and get the referral, you have to understand that several things happen. You're going to lose confidence because the more failures you make, the more you will lose your confidence. But you need to change that mindset and understand that not every one of them you can close. But you need to have these techniques that we're sharing with you. You need to be able to have the value-based ways to be able to create your company to be seen as valuable and different from the rest. Okay? So if you lose confidence, if you're not closing, if you're let's say you're just a marketer working for a company, or you own the agency yourself. If you can't close, then you have security issues. You may not be able to find where you're going to pay rent next time, or where you're going to have payroll next time. You're going to lose security because you cannot get the business to be creating the deal. You came into this business, you started working in this industry, now you're in it. Now you need to go all in. You're going to lose the security for a job. You're going to lose money. You're going to lose time. Time is money, right? Time is money. And when we talk about time, you already went in there, okay? You already went to speak to this person. If you don't get it, if you don't get those referrals, you just wasted a day. Remember, we did a calculation in a previous video that the average home health marketer, let's say, is getting paid $20 an hour. If you visit 4 people in an hour for a cold walk-in and you don't get that deal, you just wasted 1 hour of your life. Other than the fact that you lost an hour in regards to you had to pay a marketer, or you lost your hour. You lost time to be able to talk to somebody that can possibly give you a patient. So time is money. And eventually money, if you don't have any money, you won't have any security. And when you don't have time, when you don't have money, you don't have security, you're not going to have any confidence. And the biggest problem is people jump into this business, people jump into marketing, people jump into this industry thinking that you build a company, you open up a website, and patients are going to be coming in. The biggest problem in this industry is that we bring in people, or people that start these agencies and these companies are clinicians and not business people. But my job is to give you guys information. My job is to give you the information enough so that you will actually be able to know and how to do things and how to be able to be successful. How to create success for your life, for your company, for your business, for you to be able to have the security. And then as you are wasting all of this, you're also going to lose momentum. And know this, after you wasted all your time, you're going to have to start all over again. Because if you don't get this referral source, you're going to have to go to the next one and hopefully you get that. So make sure you attach the pain. Don't just be like saying, well, maybe another day. Maybe another person. The next one I'm going to do. No. Every time that you meet someone, your goal, your primary goal, is to get that person to start referring to you. Is to get that person to literally begin using your services. Every person that you talk to, every person that you want to be able to meet, you want to have that person as your referral source, as your patient. I want you guys to work hard onto that level.